Here's what you need to know if you've been prescribed chlorhexidine. Gingivitis refers to inflammation of the gums. It's a sign that you have bacteria, plaque, and/or tartar buildup on the teeth and gums. It may cause red, swollen, and bleeding gums. Chlorhexidine is an antiseptic. It kills germs by destroying their protective coverings. This helps prevent plaque and treat gingivitis. Chlorhexidine is a mouthwash that you swish around twice a day for 30 seconds after brushing your teeth, and then spit out. Don't eat or drink right after using chlorhexidine. It may cause side effects. Also, don't brush your teeth, rinse your mouth, or use another mouthwash after using chlorhexidine. This may cause it to not work as well. Side effects may include teeth staining, hardening of plaque, and changes in taste. Don't be afraid to ask your pharmacist or prescriber about affordability. These days, there are many low-cost ways to get your medication.